Dr. Farron, what causes vein disease?
Superficial vein disease is extremely common. 50% of people in their 50s will have their great saphenous vein misbehaving, where old tire blood goes backwards the wrong way. Of course, 99.9% of the medical field focuses on blood pressure and cholesterol and smoking, all those things. And certainly we agree we don't want a heart attack or a stroke. But when it comes to veins, short of being a blood clot, the medical educational system has largely ignored venous disease. There are things that contribute to it, like family history, certain occupations. Well, most of us are either standing a lot at work or sitting a lot at work, and those are unnatural things that can precipitate that. If you're a female and you have some babies, well, 3 pregnancies in particular is an increased risk factors, but it's not uncommon to see it after even 2. And then being overweight. It is a common problem, but it tends to get missed or misdiagnosed or overlooked or ignored. Unfortunately, a lot of the testing at the hospital systems only look at the deep veins. And I get it. We don't want to miss a blood clot in the deep veins, but many of these people are told that everything looks fine in their veins, and yet when I see them later, like, well, no, you got your superficial veins are the troublemakers. The bulk of vein problems have nothing to do with the deep veins, and they have something to do with the superficial veins. And the misconception that's perpetuated in the medical field is that superficial vein disease is purely cosmetic. Yet, I've had a tremendous number of people lose weight, including at least 2 of them I know of just off the top of my head who lost almost 100 pounds once we got their circulation better, started walking and getting healthier, where beforehand when they were walking, all those waste products that were puddling down below were interfering with the way the muscles were functioning. Well, if you got a car with a bad tailpipe and those fumes hang around the engine starts spitting and sputtering, you don't get all the horsepower out of that engine. And what we see in these people is that they were losing horsepower and slowing down. And it's such a gradual thing that they just didn't realize what was going on. And they were blaming half a dozen other things as to why their legs were heavy or tired or achy or swelling. 70% of swelling is actually due to vein disease. People don't know that. And they're, well, you got swelling and you're overweight and lose some weight. I know I was on the front line of medicine and was misdiagnosing and missing it for years. And so when I got into examining and studying vein disease, I was like, holy mackerel, it's everywhere. To the point where I was starting to get paranoid that I was overdiagnosing it. For 20 years, I've been doing free screenings because, well, you can have bad veins and not see the big ones underneath there. You might only just see the small spider veins or have some swelling. We give them a packet if they have a positive screen and they can follow the advice in terms of conservative ways of treating their vein disease. We feel like we're helping people by giving them knowledge and insight as to what may be causing their swollen legs or their leg pains or their symptoms. And that model's just translated well for me for the last 20 years. So, did I answer the question for you okay? I got a little long-winded.